Good afternoon. We are very pleased to have the Surgeon General of the United States, Dr. Adams, with the Black Press of America today. Dr. Adams, thank you so much for giving us a few minutes of your valuable time. Uh, can you tell us an update? We see that it seems to be not necessarily a resurgence, but an increase and an expansion of the coronavirus across the United States, particularly in the South right today and on the West Coast. What is your assessment of the current status of COVID-19 affecting all Americans today?
Well, first of all, thank you so much for having me. I'm a big fan of yours and just really appreciate the opportunity to have a conversation with you. And I think that's a great place to start. What's the status? And the number one thing I would say to your viewers is be careful about the folks who want to force you into false dichotomies, either or choices. It's either black or it's white. It's either yes or it's no. There are a couple of things that are both true. It is true, absolutely, that we are very concerned as we see rising cases across the country, particularly in the South and Southwest. But recently, we're seeing cases increase in places like Nebraska and Indiana. No one is immune to these rising cases across the country. And mathematically speaking, cases will inevitably turn into a certain amount of hospitalizations, which will turn into a certain amount of deaths. So we need to do everything we can to slow the spread of this disease. And we can talk about those measures in a bit. But it is also true that we are in a very different place than what we were in February and in March. We know who is at risk for this disease. It's older people. It's people with chronic medical conditions like obesity, heart disease, and diabetes. And we know how to treat this disease better than what we did back then. We've got remdesivir, steroids, better clinical care, which means less people are dying when they get this disease. Our case fatality rate is lower. And people aren't staying in the hospital as long as they used to stay in the hospital. We have increased testing. 50 million tests is the point we just passed over. And we know that a lot of this testing is being done now, at least not in the beginning, but now in communities of color. So we're in a better position to respond. But it's also true that we're concerned about the increasing number of cases.
Yes. Dr. Adams, the numbers obviously show that African Americans are disproportionately affected by the virus. While it may be true that it is true that there are pre-existing conditions, comorbidities, etc. But can you just give us a little bit more depth from your position as the Surgeon General? Because now we're finding that some African Americans are getting the virus who don't have the comorbidities or the pre-existing conditions, and it covers a wide range of ages. So just, I think we're hearing from you about this subject matter, because I don't want any group of African Americans or any group of Indian Americans to feel like that they are totally immune from this virus.
Well, thank you for that. Tony Fauci is the top virologist in the world. He's been doing this for over 40 years. And it's very humbling when you talk to a Tony Fauci every day and he says he's never seen a disease like this, a disease with the array of different ways it manifests in people. Some people die from it. Some people never knew they had it. Many people are in between and will have problems for weeks or months or potentially years to come. So the first thing I want everyone to know is that if you can do something to prevent getting this disease, then do it, because you don't know which group you're going to fall into in terms of negative outcomes. And it could be a lot worse than what you think. But you talked about pre-existing conditions. Important to know there are both medical pre-existing conditions and social pre-existing conditions. The medical pre-existing conditions are diabetes, their obesity, their heart disease, their lung disease. These are things that put you medically at higher risk for complications from COVID-19. But there are social preconditions, things that in the public health community, we call the social determinants of health, like transportation, like safe and affordable housing, like childcare, like a job that pays a living wage. All of these things help determine whether or not people have opportunities to make good choices. And I'll just give you one quick example here. We know that telework is something that we recommend as a best practice to prevent your exposure to COVID. Yet only 1 in 5 Blacks and 1 in 6 Hispanics has the opportunity to work from home. We know that people of color, as another example, are more likely to use public transportation where they have an increased risk of exposure to COVID-19. We know that people of color are increasingly likely to live in multi-generational housing and in densely packed urban settings, which makes it harder to social distance, harder to isolate and quarantine. And so one of the things that I have always fought for as Surgeon General, and even before when I ran the State Department of Health in Indiana, was recognizing and addressing the pre-existing medical disparities that exist, but also recognizing those social determinants of health that help put people in a position to either be lifted up by their environment and their surroundings and their opportunities, or which helps push people down and makes them more susceptible to diseases like COVID.
Very good. Thank you. The question of mask. There's some debate about whether or not everyone should wear a mask. What is your position as a Surgeon General? Should all Americans, given the complexity and the depth, as you've stated, of the COVID-19 virus, should all Americans be wearing masks?
So the best science we have available right now tells us that the debate is over. We all should be wearing face coverings to prevent spread of COVID-19. I have mine right here. And I want people to understand that science is all about making the best recommendations you can based on the information you have, but then having the humility and the vigilance to continue looking at the data. And if the data changes, then the recommendations change. Again, as Tony Fauci has said, this virus is incredibly tricky. He's never in his 40 plus years of work in this area seen anything like it. Originally, we thought this disease couldn't be spread by people who didn't have symptoms. What does that mean? That means you and I are standing in a room together. If you have a runny nose, a fever, watery eyes, you're coughing, I'm going to know you're sick and I'm going to stay away. And ideally, you're going to know you're sick and you wouldn't even come in the room in the first place. That's the way we've operated with viruses like this in the past. And it's why we've only told people to wear a mask if they had symptoms and knew they were sick. Well, 50% or more of people with coronavirus, we've now discovered, can spread disease even without having symptoms. That means you and I can be sitting in a room together and you wouldn't even know that I had it. And that's why I wear a face covering as a sign of respect to you, to protect you from my potential asymptomatic spread. But what I want the younger people out there especially to know is that this is about not just protecting yourself, it's about protecting those who you love. The last thing you'd want to do is take a virus home to your mother, your grandmother, someone who lives with you, who you could put at risk. But this also helps you in an indirect but very tangible way. We know the biggest barrier to opening schools, to getting back to worship, to going back to football games. I'm a Colts season ticket holder. I want football this fall. But the only way we get there is if we actually lower disease spread. And right now, I'm worried that these things aren't going to happen because we have rapidly increasing cases. But there are three simple things everyone can do to lower spread of disease. The 3 W's: wear a face mask, wash your hands, and watch your distance. We know if we do these things, we can turn around the epidemic very quickly. Italy, just 2 months ago, we were talking about people dying in hallways because their healthcare system was overwhelmed. Italy is now open for tourism again. They're playing soccer games. They're opening schools. So we can do this even without a vaccine if we take simple measures. Please understand this is a small inconvenience that will provide big benefits for you, the ones you love, and your communities.
Well, thank you. We'll make sure that all of our readers, all of our viewers adhere to the 3 W's. Thank you for breaking it down. You touched, and I'm going to go back to this issue of vaccines. We know as in the medical sciences, and certainly you are our leading medical authority and as the Surgeon General, and it's going to take time to get this vaccine right. But I'm concerned, and I want you to comment on it. There seems to be groups already trying to convince people of color, trying to convince other Americans not to take the vaccine even after when it comes out. Well, what is your position on the importance, once a vaccine is found as a cure, that everyone be immunized appropriately?
I am so glad you asked that question. I want to tell you one of my biggest fears. One of my biggest fears is that we do everything right. We find a vaccine that's safe, that works in a record amount of time, but then it worsens disparities. And how could that happen? Well, less than 50% of adults actually get vaccinated for the flu each year. And that number is even lower in the African American community. So if we come up with the best COVID-19 vaccine in the world, and Black people either can't get it or won't get it, you're actually going to see disparities in COVID outcomes worsen. We need people to understand that vaccines are safe, they're effective. They're one of the number one tools we have for preventing disease over the last 50 years. When you look at deaths averted due to measles, due to mumps and rubella, due to flu, but they only work if you actually get vaccinated. So I'm working now on outreach with communities, because the other thing that I have to be honest about is that communities of color in particular have a lot of historical reasons not to trust the government, not to trust science. When you talk about Tuskegee, when you talk about Henrietta Lacks, and when you talk about a lot of the things that have occurred to people of color over the years. And so we're working to make sure people understand how we're going to ensure this vaccine is safe. We also want to make sure we have people of color enrolled in the vaccine trials, both so they can contribute their thoughts to how they should be conducted, but also so that we can say with certainty that they're effective in communities of color. Because you remember this, we have drugs out there that we thought were effective for high blood pressure and asthma, but we found out that they weren't effective or as effective in African Americans because they were never tested in African Americans to the extent that they were in the white community. We need to make sure people are involved in drug trials and that we are doing everything we can to have outreach to those communities. There's a saying, people need to know that you care before they care what you know. And I'm working hard to help communities of color know that I care and that we want to make sure we are doing everything possible to worsen some of these disparities that exist.
Well, thank you very much. And I know your time is limited. Just two more questions, very short. The clinical trials, the NMPA, the National Newspaper Publishers Association, we've been in touch with some of the some pharmaceutical companies, particularly Pfizer and others who are working on clinical trials. But again, the challenge is to get people of color to participate in the clinical trials. Can you just comment, as Surgeon General, how important it is that a diversity of people, including people of color, African Americans, would volunteer to participate in these clinical trials if we want to come up with a vaccine that's effective?
Well, it's incredibly important because, again, you could have a medical treatment that we think works that doesn't actually work. I want people to know that we are putting safety at the top. It's always been at the top, but we are, while we're working at an incredibly fast pace to develop a vaccine, all of us doctors on the task force are every day asking, what are you doing to ensure safety? What are you doing to ensure safety? And I have every confidence that if a vaccine is actually recommended to the American people, that it will be safe. But I can't assure that it's going to be safe for African Americans if we don't have them involved in their trials. It's critically important that you be willing to participate in trials, but it's also critically important that you demand to know what's going to happen in those trials. So be an informed participant in those trials. Take the time to understand what they're about. Ask people to explain it to you if you don't understand what it's about. But please be willing to participate in these trials so that we can ensure safety and efficacy for everyone out there.
Well, thank you. You know, we're aware of your work that you did so well in Indiana, and now you're working for the federal government as our Surgeon General. I always ask distinguished individuals that we are privileged to interview this last question. How do you view the importance of the Black press, Surgeon General, to get the message out of healthcare, medical care, and in particular now with the pandemic of COVID-19?
Well, before we started this interview, one of the things I said to you was that I was looking forward to having this conversation with you, not just because I look to you as a role model, but also because it's important that we speak to the Black people. And Black press is critically important to making that happen. Again, people need to know you care before they care what you know. You need to speak to people through outlets that they know and that they trust. Critically important. We have a pandemic of virus. Well, guess what? We also have a pandemic of misinformation out there that is hurting, that is harming, that is killing too many Black and brown people. And so the Black press is critical to getting that information in the hands of people so they can make informed decisions, and also for highlighting issues that are of concern to the African American community. Because far too often, people don't have their concerns raised to a level where we can really implement change. So I want to say thank you for the opportunity. I want you to know and to share with people that they have an advocate. And you talked about my work in Indiana. I've spent my life, my kids actually joke, they say, Dad, how come you keep getting more and more important jobs that pay less and less money? I've taken a pay cut with every job I've had in my career. But I've done it because it's been an opportunity that I think God has placed me in to have an even bigger influence with each move on lifting up vulnerable communities, whether that's tackling infant mortality or maternal mortality, both of which disproportionately affect African Americans, or my work in the HIV community, which again impacts vulnerable people, or talking about the opioid epidemic, which has impacted my own family. My own brother has been incarcerated for crimes that he committed due to his addiction, or highlighting the impact of COVID-19 on communities of color. I feel it's important that I use my bully pulpit and that we use institutions like the Black press to get information to people so they can be their healthiest selves.
Well, thank you, Surgeon General Jerome Adams. Thank you for your leadership, and thank you for spending this time with the Black Press of America. We want to stay in touch, and please see that we want to be your ally in getting the right information out. The urgent information out, not only to Black America and to Latinos, but to all Americans. It's so critical. I've always said we're stronger when we work together to get the truth out.
Stronger together, sir, and I look forward to working with you. I have calls to action on high blood pressure control and on maternal health coming up in the future, so hopefully we can talk about those in just a few weeks.
Absolutely. Thank you. God bless.
God bless you.
All right. This is Benjamin F. Chavis Jr. Continuing. We just had an outstanding interview with the Surgeon General of the United States, and I'm pleased to have joining with me the senior correspondent for the National Newspaper Publishers Association, the Black Press of America. He's more than a journalist. He's a freedom fighter, a father, and someone who's helped move the NNPA to a high level of not only journalism, but impacting and challenging to make sure that we improve the quality of life of Black Americans, the quality of life of all Americans. None other than Stacey Brown. Thank you for joining us, Stacey.
It's my privilege, Dr. Chavis.
And I think we probably made some news.
Oh, absolutely.
The Surgeon General was categorical in his affirmation that all Americans should be wearing masks.
Yep.
Without exception. And I think that was a newsworthy statement that we definitely want to get out on our own newswire, but across the country, so people will not take this disease too lightly. He also got into some details about the importance of people of color participating in the clinical trials that are now going on, as well as when the clinical trials are over, to make sure that people understand the value and the life-saving importance of participating and taking the vaccines once they're ready, so that we could not only stop the spread, but eventually stop this disease. I think it's very, very important that Black people get the right information at the right time, and there be no lag in how we respond to this. But let me hear from you, Stacey. What did you hear?
Well, two things that you just mentioned. The Surgeon General has said now unequivocally to you, Dr. Chavis, he broke that news to you, that he says that we should be wearing masks. We know that wasn't always his position. As recently as last week, he had made comments that pretty much left it open to the individual. Now he's
because of the Trump administration has been ambivalent. The president himself has been ambivalent on whether or not all Americans should wear masks. So I think this was a statement forward, a
Yep.
more clear, categorical statement from the Surgeon General. I'm glad he made the statement to the black press.
Oh, absolutely. And it resonates too, Dr. Chavis, because just today, more than 150 scientists and medical experts, top medical experts in the country, have sent a letter to the White House and to legislators saying that their opinion is that we should restart. We should shut down again and restart because the coronavirus has recently seen such an uptick. The United States now has more than 4 million reported cases now. Death toll is at 144,000 and climbing. So it's a shift that the administration really had to make. You have to mandate masks. And the other thing, Dr. Chavis, you mentioned with the Surgeon General with the vaccines, we know historically African Americans, and for good reasons, we have shied away from these clinical trials. We have not trusted the medical community. And again, that's for obvious reasons. We've been let down time and again. We have been misinformed time and again. And so I think it was so important that you asked that question about these clinical trials. And once they do develop a vaccine, which I understand that they're in the process of finally having one that actually may work.
Yes. And the way that they find out if the vaccine actually works is through the clinical trials, the diversity of the clinical trials. If they only do the clinical trials with a certain ethnic group or a certain age group, then we really won't know. And I think that this virus is so deadly, we can't. It's not like a where you roll the dice and see what happens. I think in this instance, because of the virus is so deadly, we have to be very sharp in the science, but how the science is applicable, how the science is applied to a diverse group so that the vaccine will work on a diverse group rather than have a vaccine for one type of person or from a particular background. We need a vaccine that's more universal. And then, of course, this is a global pandemic. This is just not an American pandemic.
Yep.
Whatever vaccine is developed, hopefully will serve not only the American population, but will serve the world population. It's in our mutual interest, Stacey, that we come up with a pandemic solution to the pandemic problem, rather than a partial solution to something that's impacting the quality of life for millions, hundreds of millions of people throughout the world.
Yeah, absolutely. And I also, Dr. Chavis, I appreciated the candor that the Surgeon General spoke with. He really wanted to talk to Black America. And
Yes.
We don't often see that. We do have, and the Surgeon General is not a politician per se, but we do have politicians and others on who may agree to an extent the importance of talking directly to Black America. But we know it's vital that we have people like the Surgeon General to talk about, talk to Black America. And the only way to really talk directly to Black America is through the Black press.
Absolutely. You saw I kind of put in that question at the end, and he elaborated extensively on the importance of the Black press, but also how he feels himself as a father. Yeah, this is the first time I've heard him talk about his family. You know, so he has a certain passion about his job as the Surgeon General that I don't think most Americans know about. You know, it wasn't just a political appointment. He's been at this healthcare work for years before being nominated as the Surgeon General. He's a Vice Admiral in the Navy, distinguished career. And I think that, you know, I'm hoping, Stacey, that we can get him back even for more in-depth discussion sometime in the near future. As he mentioned, that there are other maladies in addition to COVID-19, heart disease, diabetes, lung disease. We have the open enrollment for Medicare coming up in the fall of the year. And there's always a struggle to try to get Health and Human Services to spend some of their advertising dollars with the Black press. So I think this was a good opening. For the substance of what he said, But I see, you can comment on it. I think the door is open for some working together.
Oh, absolutely. And I think he was very clear on that. And I think he actually was reaching out to work with us, to work with you and the Black press. You talk about the door being open. Well, later in the week on Thursday, the 31st at noon, we will have Dr. Anthony Fauci, who right here on the Black Press Live, who he mentioned as to looking up to for certain information, because we know Dr. Fauci, of course, is the leading expert on infectious disease in the country, and probably the foremost in the entire world. So we are also looking forward to having Dr. Fauci Thursday, the 31st. We hope that folks will tune in. I'm sure folks will tune in for that as well, because again, the message to speak directly to Black America is so important.
Exactly. Well, we're looking forward to it, and we need to promote the fact that Dr. Fauci is coming on with us on the 31st. And of course, one of the great things about these live streams, Stacey, they live on our website,
Yes.
At blackpressusa.com, because we want and other channels that we can announce, also on social media. One of the things we touched on was some of the misinformation out in the media about COVID-19, about the vulnerabilities and the disparities when it comes to African Americans in the healthcare arena, particularly that the COVID-19 has shed greater light on. But so that's why I think our job, Tracy, in the Black press is to make sure we get the truth out to the people, but we get it out in a timely fashion, and we try to reposition this information so that people can constantly tap into it. So even after this broadcast, we're going to make sure that we have some kind of archive where people can always go back and hear it, because it's always good to hear directly from the authorities. And I thought it was so good. He's probably one of the youngest Surgeon Generals that the United States has had. He's not the first Black, but he's one of the youngest. And I think that we need to try to facilitate even hearing more from him as this year and next year continues.
Yeah, absolutely. And as you well stated, having someone of authority who can speak with authority is so important. Oftentimes we talk to others who may have their finger in the field, so to speak, but they're not necessarily as a renowned expert. We really need these renowned experts because, again, we stated this already. When it comes to the medical and science, Black people have been for centuries given more reason not to trust than to trust. So it's important.
Exactly, and of course, one of the things that I'm so proud that the Black press is the trusted voice of Black America, and so the extent to which Stacey and Norman and Claudette, our whole team, that we get involved and others from the NMP, our chairwoman. Karen Carter Richards, the distinguished publisher of the Houston Forward Times, and all of our publishers. I think we have an opportunity to, because we're the trusted voice of Black America, to get this information out consistently during this period of time. I think the last thing we need is for anyone in our community to go around and not be informed, to go around and allow themselves to be misinformed by some of the falsities and inaccuracies, some of the myths even.
Well, you spoke about
yes.
The whole melanin thing, and I was so glad you brought that up too, because it was obviously something that the Surgeon General had also been aware of.
Absolutely. So I think we're in good shape, and I appreciate you taking this time, Stacey, to have this post interview with me as we welcome the Surgeon General of the United States to the Black Press of America. I think this is an ongoing discussion, ongoing dialogue, and certainly I want to give you time now to go put your pen to paper so you can get this breaking news story done on what the Surgeon General has just reported to us live on the Black Press.
Absolutely. Thanks a lot, Dr.
Thank you. God bless.